It is time again for Tooth Talk with the Dental Diva. We have Dr. Sylvia from Jasper Dental Associates with us, and today I believe we're going to talk about dentures.
Let's do it.
Let's do it. I am a denture wearer. Now everybody knows, right? Was in so much pain from gum disease and such as that I just finally had it and said, pull them all. Not the right choice, I have discovered since then. Way too young, and it was just a nightmare. So tell us how we can avoid the nightmare dentures.
Well, I like to tell everybody that no matter how well I do my job in making a denture, they're not going to like it because it's not like your real teeth. And I think you just stated that. There's nothing like your natural teeth.
Right.
So whenever possible, we encourage keeping your teeth. But there are some cases when there's been a lot of neglect, a lot of broken down teeth from decay, gum disease, that it is the best answer. So I try to prepare a person for what it's really going to be like. It's a piece of plastic. It's in your mouth. It affects the way you taste things. You can't chew or bite into food the same way that you did with your own natural teeth.
You have to relearn how to eat. You really do.
Your speech is affected. Everything is different. But again, there are ways to make it a little bit better. The best thing that a person can do is have 2 implants placed either on the bottom or the top so that we can make the denture snap onto these implants with what we call attachments. We call them, the name brand is Zest attachments. And so they essentially snap onto the 2 implants that protrude a little bit from the gum line. Those folks are the happiest denture wearers because they don't wobble, they don't come loose as they do when you don't have these in place.
You don't spit them out when you're talking to people. Yeah, I'm sure it's great.
They feel more secure. And I think you probably have better chewing or biting power as well. But some people can't afford that, and I understand it. So in those cases, we make the best fit that we possibly can and explain to people that it can take up to a year to relearn how to use these instead of your natural teeth. Some people never quite have a very tight fit on the upper because your anatomy plays in how well they fit, and if your palate is shallow, you don't have as much of a suction cup effect. The person with a deeper palate has more of a suction cup effect and can then hold it in place better. But some people have to use a little denture adhesive just to make them feel more secure.
Right.
And we teach how to do that, like by applying not a big line as you see it on television
just takes a couple of little dots.
With 4 places and it makes it feel a lot better.
And once I learned that, it got a lot better. Once I quit packing my mouth full of adhesive.
Nobody likes the way that tastes or feels.
It's terrible. And then you can't get them out, and it's very painful to pull them back out when it's time to go to bed.
And there's an adjustment period. With in any case, when you're going from having your natural teeth to having a set of dentures, there can be sore spots because it's like wearing a brand new hard shoe. And we tell everyone to be sure and call us and let us help adjust the denture so that it can relieve pressure in those points that can cause ulcerations and pain.
One major personal recommendation from me is do not go to the discount denture places. Go to someone like Dr. Sylvia. Go to Jasper Dental Associates. Do not go to these because you're getting what you pay for. You really are. And this is something.
It's one of those things I believe shouldn't be rushed. It takes time to make a denture that is beautiful and fits well. And we take the steps that are necessary to do that. So we go through, and I'll give you an example. If you have no teeth, let's start with a person who still has teeth, and those teeth need to come out. Well, we start by taking an impression of the existing teeth, and we make what's called an immediate denture. And that denture is made in part by looking at a person's tooth size, shape. We can correct some positioning if the teeth need to be straightened out. But the laboratory makes this denture by literally having a stone model of how your mouth looks today, and they will cut one tooth off at a time and place the denture tooth there on the model to mimic where your teeth used to be. There are some restrictions because since you already have teeth, you have teeth that have not been removed yet, it can't be tried in. So some of the instructions that I have to provide to a laboratory in that situation is where your center or midline of the face is, so that they can either improve your symmetry or keep it the way it is if you're already happy with it. But I'm trained to make an immediate denture that can actually be used for years. And so it takes, as I say, a little bit more effort. Now, if you've had all of your teeth removed and you're making a denture, whether it's your next set or circumstances are such that you've already had them removed for whatever reason, then we take impressions of your gums, how they look. And the first step after that day is to come in and trays that look a little bit like dentures are used with a wax rim in place that mimics where the teeth should be. And so I'm able to take what we call records of, again, the center of the face and where your smile line should be based upon your lips. Everybody's not symmetrical, and we have to remember that we may be off just a little bit, but that's normal and natural. But at this point, you can now have the teeth come back in wax and try them in so that you can see how they're going to look before we process them. And all of this takes a little bit more time, but it's a better process for a better result compared to what your experience was.
My experience was they ripped out 26 teeth at one time. I went back, I think, in 2.5 hours. They shoved these other things in my mouth and said, good luck. It was brutal. And I was left with so much splintering and so many tooth particles still in my gums that even though the fit wasn't terrible of the dentures, couldn't wear them because it was too painful because I had all this bone and tooth coming through.
It's a very, I think it's a more, I think the process of having all of your teeth removed and going through it is much more traumatic than people imagine. I hear that, and I especially hear it. It typically is a woman who tells me these things. In my experience, men can, it seems, tolerate some of these things a little bit better, if you will. But those are also the same men who take out their toolboxes at home and can completely foul it up when they're on their own. So it is, but it's a hard piece of plastic.
My late husband never had any trouble.
And you're going through the trauma of removing all of your teeth, and it's important.
Now, do you do that? Do you, if it's someone needing everything removed, would you remove that many at once? Do you recommend that?
And that's what I really didn't complete a minute ago when I was talking about immediate dentures.
Oh, sorry.
No, it's not your fault. When I make a denture for someone who needs to have their teeth pulled out, we use the existing teeth to guide us. We make the denture and hopefully make some improvements and have it ready so that when you go to the oral surgeon's office, you have all of your teeth removed and the denture's placed that same day. It acts as a pressure bandage. And I ask that you come back to see me the following day. I do use an oral surgeon for this, number one, because of the number of extractions, and secondly, because he can shape your bone. Sometimes it's necessary to actually round the bone so that the dentures fit more comfortably. So that is done at the oral surgeon's office, and you have your denture ready that day to go in at his office, and come to see me a day or two after that.
Well, in my case, I had several areas where there was a protruding bone, and they didn't do all that.
Well,
that's what I'm saying. Do not go
one of those
to
steps that is better for you in the long run.
And, well, I certainly wish I'd had it done that way. I had a lot less trouble because it was horrible.
Well,
it
now,
really was.
Some people have dentures and they don't have the implants, but I just want everybody to know that you can still get the implants and retrofit the denture to snap over these attachments. So even though you already have a set of dentures, you can still get implants to make them fit better.
And that's certainly something that I've been considering. More so since I've been talking to you and we've been doing the show. But as I said, my late husband had no problem. Went to the same place I did. They took out not as many as me, but a bunch. I don't remember how many at the same time. Immediately put his dentures in. He was fine. He was eating with them by the next morning, and never really had an issue. Never had the tooth pieces and the shards coming through his gum line like I did. He just didn't have all that difficulty.
What were your expectations? What did you think?
To have no more pain was
Okay.
that was my biggest thing, was to make it stop
How
hurting.
long did it take in your memory to get to that point in the process?
After they removed everything, it's only been about a year and a half since I still had to go to an oral surgeon and have more shards removed that were trying to work their
So
way
the
through my
process-
gums. And I had it done in 2012.
So it took a few years to
Yes.
completely adjust to it and get through the healing.
Yes, well, if I hadn't had all that stuff still coming
Right.
out,
I'd like to know that. I would like to hope that it takes a little bit less time than what you've experienced. And
right? Well, I honestly believe it was just brutal at what they did to me. I don't think they took a lot of effort and care in how they removed them, and they just left a whole lot of pieces behind. And when I did have to have the shard removed that was coming through my skin, he opened up that whole, I don't know, a 2-inch section of my jaw and cleaned out all kinds of stuff. And this was 4 years later, almost.
Does it not sound like a good experience?
It was a horrible experience.
I think that can be improved upon.
Yes, that's why I'm trying to tell them, do not go to these discount places, because I believe that's what that's how they treat you.
I have seen some nice cases,
Mhm.
to be honest, to come from those places. So I don't want to completely discredit. I hear your experience,
Right.
but you and your husband had different ones as well.
Right.
But I do believe the way that I make these dentures here at Jasper Dental Associates, it's a more methodical and thoughtful process. It's not hurried. But I will add to that, if you have your existing teeth, that then they become an immediate denture, which has limitations such as not being able to try them in because your teeth are in the way. You can't
Mhm.
put them in there. And it sounds like that's what you had. But those can still be made in a way that can be used for a long time.
Well, they just, it was just very rushed, very in and out, and we're done. Bye. Good luck. It was very much that way. Where's your money? You brought your check, right? And then just, they did what they did and sent me on my way. And I had really no backup, no follow-up care, no anything, except come if you have a problem and we'll be glad to charge you again. So it was really a nightmare. So I would urge people to really think about it. I know if you're in a lot of pain like I was in excruciating pain all the time. We all know how bad toothaches hurt.
It can be miserable.
And I had several hurt with the
cost is
toothache.
a factor. I mean, if a person can afford it, implants and implant bridges are the best in terms of replacing missing teeth.
Mm-hmm.
A lot of people still wear partial dentures. I say that I rarely meet someone who actually loves their partial denture. So I'm trying to encourage more people to get implants instead of a partial denture because the results are so much better. They're like your real teeth, and we can talk about that next time if you like.
Well, they actually, I asked them about implants, and they actually said there was a lot of damage to my bone, down in there is why it wouldn't work for me.
With the right surgeon, I think.
But that was after. I fully believe they are the ones that damaged my bones. So that was after the fact. They're like, oh, we can't do it now. Your bones are too messed up.
The right surgeon takes care to be as atraumatic as possible. And
Right.
he has a bag of tricks. And one of those is bone grafts that can replace some of the bone that has been destroyed or damaged
Mm-hmm.
in preparation for placing an implant. So we have options. We have a lot of options.
You
now.
do have a lot of options, but
But sometimes the denture is the answer, and we like to make the very best
Well, and I totally believe, as I said at the beginning of this segment, go to a place, go to Jasper Dental Associates, as opposed, that would be my personal recommendation, as opposed to one of these economy places.
We don't want our patients out in the community smiling and obviously having dentures, so you may not be able to recognize. That's what we hope, that we make a set of dentures that most people will look at and think they're your teeth.
Well, now, I'll have to give them that. People do think these are my teeth. They have no clue I have dentures, most of the time. Of course, as soon as I get home, they're out. Still, at this point, as soon as I get home, they're out of there. Because I just feel them all the time, and they're always a nuisance.
Well, it's good for people to hear. Although, if you need a denture, please do come see me, because
Yes,
we can
please
make
go
a
see
good one.
her, not who I went to see. That's my point. Don't go to, you get what you pay for. And unfortunately, that applies to all things. And I just really feel that way, that I was just herded in and herded out, and give us your check and good luck. And the personal care you're going to get at Jasper Dental Associates is so far beyond that.
We think it's very important that we do provide that service here in
Yes.
Jasper. Yes.
I do as well. All right, well, we have eaten up our showtime already today. It goes quick. And you're going to give us the information, location, and phone number for Jasper Dental Associates.
We're at 938 West Church Street, Suite 104. And our phone number is 706-692-2611. Give us a call.
And y'all make sure to tune in every Saturday at 2 o'clock for Tooth Talk with the Dental Diva, right here on your hometown radio station, WYYZ Jasper.